For MRI of whole abdomen, position the patient on head first supine and place the body coil over the abdomen area so that the whole upper part of the liver and down to the symphysis pubis is covered, and tied the body coil with strap and give a headphone to the patient and a squeeze ball to the hand. And now go to the console and first register the patient from patient register option and put the patient name, the patient ID and sex of the patient, and then age and height and weight of the patient. And referring physician is optional. The bold letter text are compulsory. Patient position head first supine and then click exam, and from the protocol list select the upper abdomen first and then the lower abdomen. So I will take upper abdomen first. I select whole abdomen. There is a folder that is saved whole abdomen, and then but I have select manually the protocols. I have to select manually from upper abdomen. So at first I will take the upper abdomen protocols, and now HAST localizer is running, and I am searching for another protocols, that is T1 is missing. T1 op in I have added to the list. And for HAST localizer, ask the patient to hold his breath, as this is a breath hold protocol. And then press the continue button and the localizer images will appear. So this HAST localizer will give you sagittal, coronal and axial image of the abdomen. And now I have to plan for the T2 HAST coronal, that is the first proper protocol for abdomen. For this coronal protocol, I have select the image number is 30, the slice thickness is 5, and plan over the sagittal and axial images for coronal, and include the whole liver and down to the symphysis pubis. So I have keep an idea to cover the area. And now I will plan for transverse protocols. So if this notification comes, SAR limit exceeded, so I always try to keep in normal mode. So I increase TR, and click OK, and the scan will continue in normal mode, and I avoid fast level mode because this is a risky a little bit. And for coronal, tell the patient to hold his breath and click continue, and the HAST coronal of whole abdomen will scan. You can see on the progress step window that the image is coming and the scan is continuing. So now this is the break between the first and second scan, and patient now taking breath, and again tell the patient to hold his breath and then continue again, and the second phase of this HEST coronal will scan, and you can see the live images on the progress step window. Yeah, that's it. T2 HEST coronal scan has finished, and now scan is paused. And now I have to drag the coronal image to the exam tab and plan the transverse protocols over this. So you can see that the lever is slightly up down because patient can't hold his breath in proper way, but I have to plan over this. And now I am planning T2 HEST transverse, and for this I have taken 27 slices, and slice thickness is 5 and distance factor is 40, and planning over the coronal image, and then click apply and include from the upper part of the liver and to the mid kidney level. And this is also a breath hold protocol. Now all the upper abdomen protocols are breath hold, multiple breath hold protocol. And for other axial images, T2 HEST, FATSET and T1 flash open transverse, I just copied the plan from the T2 HEST transverse. So all the transverse protocols are in same planning. And now I'm waiting for the adjusting of the T2 HEST transverse protocol to be scanned, ready to be scanned. And when ready, I will tell the patient to hold his breath. Now tell the patient hold his breath and then press the continue button, that is the green play button. Now the scan is running and patient is holding his breath, and this is the first step of the scan, T2 HEST transverse. And now it's the break between the first and second phase of the scan. Now again tell the patient to hold his breath. After sometimes hold his breath, patient hold his breath and press the continue button for the second phase of the T2 HEST transverse protocol. So because patient have to hold his breath for multiple times, and that because of this it's called the multiple breath hold sequences for upper abdomen. And now the second transverse protocol is T2 HEST FATSET transverse is ready for scan. And now tell the patient to hold his breath and click the continue button, and the first scan will continue and image will appear on the progress step window, and you can see the live image of the transverse FATSET. And now it's break between the first and second phase of this protocol. Patients now taking his breath normally, and then after a few times again tell the patient to hold his breath and then again continue for second phase of this scan. So completed the second protocol for transverse T2 HEST FATSET, and now the scanning is paused for a few seconds, and then T1 transverse will open, and this is an open, that means the oppose and in phase protocol for T1. And again tell the patient to hold his breath and click the continue button for T1 of in transverse multiple breath hold. You can see that the scan is running, and now is the break between the first and second phase, and patient taking breath normally, and then again tell the patient to hold his breath, and then again press the continue button for second time, and the scan is running and image appears. And now is the break between the second and third phase, and this protocol, in this protocol we have to tell the patient for third times to hold his breath and then continue again. And now the third phase of this scan is running and it's completed. So my upper abdomen protocols have been taken, and now I will go to lower abdomen. And for lower abdomen I am selecting from the lower abdomen folder and selecting some protocol and drag them into the exam list. So at first I will take the T2 coronal image for pelvic region, and for this I have to plan on the sagittal and axial images. Now I am planning almost blindly over the sagittal image by keeping an idea of where to plan, and finish the planning for T2 coronal. So I get my T2, I got my T2 coronal image, and now on this coronal image I will plan the transverse image for pelvic region. And you can see in this region that the prostate is enlarged and there is some nodular lesion on the prostate. So I have to include the prostate when planning in the pelvic region. I am increasing my field of view to 300, and for axial images the slices number is 35 and the slice thickness is 5. So I am increase the distance factor to 70 and the slice number is 35, and placing the saturation band in front of the abdomen, and then apply the protocol. So T2 transverse protocol have been planned, and the rest of the transverse protocols copied the planning from the T2 transverse. And now I have dragged the T2 sagittal protocol for pelvic region and planning over the coronal image for sagittal. So for sagittal protocol I have select the slice thickness 5 and the number of image is 35 as set. So all my lower abdomen or pelvic protocols have been planned, and the scan will be completed automatically one by one. And now let's print some images from upper abdomen. Select the coronal image and send it to the filming, and go to filming and select the layout 5x5 so that 25 images fit in the film, and there is extra 5 images. You have to delete 5 images from anterior and from posterior side, and place the reference image at the bottom at the left bottom corner. Adjust the window and then print out, and now select the T2 hash transverse and send it to the filming, and find the reference image of this upper abdomen and also send the reference image. And now in the filming, for transverse image, change the film layout to 4:7 so that 28 images fit in the film, and adjust the reference image, zoom in and pan the image at the perfect position, and also zoom in the T2 transverse hashed transverse images so that it perfectly fit in the segment. And then print out. And now I have to select T2 hashed fat set transverse upper abdomen. This is the sequence. Select the series and send it to the filming, and also send the reference image of the transverse images, transverse protocol, and go to filming, and again select the layout 4:7 and remove the reference image from the segments and zoom in the transverse image. Adjust the window and also adjust the reference image at the bottom. So this is the third film that I am making. And then print out. And now I have to select the T1 transverse from upper abdomen. So in T1 there is two series, one is opposite face and one is in face. This is opposite face image, but I have to select the in face images from the last series, and select the series and send it to the filming with the reference image, and change the layout to 4:7. Remove the reference image from all the segment and zoom in the images so that it perfectly fit, and also adjust the reference image of the upper abdomen transverse. And this is the fourth film that I am making. I have already printed one coronal, that is total whole abdomen, and 3 transverse upper abdomen. And now you can see that scan for lower abdomen is running, transverse scan. And let's print out the T2 coronal pelvic area or lower abdomen. And for this I am selecting the series and send it to the filming. And now go to filming and change the layout to 4:6 so that 24 coronal T2 coronal pelvic image fit in the film, and there is extra 4 images. You have to delete 4 images from the front and the back and zoom in the image. So I told earlier that you can see that the patient have a benign prostate, enlarged prostate. So you have to cover the prostate in all the protocol. and now T1 transverse running, and then T2 sagittal will scan. And now I will select the T2 transverse now for pelvic. This is T2 transverse lower abdomen area. Select the series and send it to the filming, and find the reference image for the T2 transverse, and then send it to the filming. And now go to filming and select the folder, change the layout to 4:7. So here is less image, so I have to change the layout to 4:6. I have to delete 2 images, and now it's okay. And remove the reference image and minimize the text or customize text from each segment, and adjust the reference image. So this is the 6th film that I am preparing. And now go to T2 transverse fat set lower abdomen, select series, send it to the filming and also the reference image. Select folder, layout 4:6, delete 2 images there because there is extra 2 images at the back, and now there is only one film. Remove the reference image from all the segment, select series and adjust the window and zoom the image a little bit to perfectly fit, and also adjust the reference image and print out. T1 transverse scan is running, and then T2 sagittal. And now I have to drag post contrast images from the lever dynamic. You can see that I have to take the dynamic protocol for upper abdomen. For this, first I have to take the T1 Vibe fat set pre-contrast. This is the protocol, and then I will take the same protocol but in 3 phase: arterial, venous and delayed phase. T1 Vibe fat set transverse. This is the T1 transverse for lower abdomen, and you can see that the saturation band is over anteriorly cut out the anterior part of the lower abdomen. For this I have to repeat the protocol. I have to repeat the T1 transverse protocol because the saturation band was above the anterior part of the pelvic. So I have to replace the saturation band, and you can see that the saturation band is over the anterior part, anterior pelvis. So I am now moving the saturation band out of the field of view. So this is the right way of placing saturation band, and now there will be no artifact. And I am also increasing the field of view a little bit, and now click apply. So this is the last pelvic protocol, pre-contrast protocol. And now let's print out the T2 sagittal, and you can see that the prostate is enlarged, and also the bladder wall is infected. And select the series and send it to the filming, and the layout is 5:5 for the sagittal. And zoom the image. So for reference image I will drag one coronal image from the browser. So I will select it from the T2 coronal pelvis and drag the image to the filming, and now it's perfect, and then print out. So last T1 transverse protocol for pelvis is running, so I have to wait for this, and then pre-contrast T1 bifid set, and then the post-contrast T1 bifid set arterial, and T1 bifid set venous, and T1 bifid set delayed. So these are the dynamic post-contrast protocol for liver. So I have already taken the post-contrast protocol that I am failed to record. Sorry for this. So now the delayed T1 bifid set transverse is running, and the patient breath hold. I missed the scan to record, but I can show you the images how it looks, the T1 bifid set pre and post contrast. So now I am planning for the post contrast pelvic regions or lower abdomen, and now I am planning for the T1 transverse fat set post contrast for pelvis. And for this I have just copied the planning from the previous pre-contrast T2 transverse, T1 transverse or any transverse protocol. And for sagittal protocol I am again copied the planning from the T2 sagittal lower abdomen and apply. And now the T1 coronal fat set, and for this I will copy the coronal plan from the previous coronal pelvic planning, but here I am adjusting manually the planning, rather copying. And now planning for the coronal T1 coronal fat set post contrast, and all the post contrast protocols have been planned. And now let's see the post contrast upper abdomen T1 bifid set images. So this is the non-contrast protocol T1 bifid set. The first sequence, the non-contrast, and you can see that at the bottom the first sequence is the arterial phase. This is the arterial phase, and the second series of the at the bottom is the portal phase or portal venous phase. You can see that the contrast is reached the portal vein of the liver. And now select the arterial phase first and take it to the 3D, and in 3D make axial images planning on the coronal, over the coronal, and I will make 23 arterial phase images and click start and send it to the filming, and also the reference image, and the layout is 4:6, and remove the reference images, adjust the reference image and zoom in the images. So you can see that the contrast is only visible in the arterial system, especially in the abdominal aorta, and also at the hepatic artery, and also in the splenic artery, pancreatic artery. And now I have to select the series of the T1 bifid set transverse portal venous phase, and select the portal banner space series. And because there is lots of image, so you can't print directly from this series. For this you have to make images from this, and for this you have to take it to the 3D, and from the 3D again on the coronal image press the parallel ranges transverse lines and increase the slice number to 23 and drag the first slice to the dome of the lever and drag the last slice to the end of the kidney, and then click start. And you can use save as, and then you can enter the comment portal base and also the reference series or series name portal Venus face. So this portal Venus will be written on each image at the bottom, so that radiologist can understand that this is portal Venus face. And now go to patient browser and select portal Venus face series and drag it to viewing, and you can see that at the bottom there is portal Venus face written. And select the series and take it to the filming, and the layout is 4:6, and adjust the window and zoom in the images and feed the segment, and also adjust the reference image. So this is the T1 by FatSet portal Venus face that I have printed, and T1's transverse FatSet. This is the lower abdomen, T1 transverse FatSet. So all the protocols have been scanned, and close the patient. And now just I have to print the lower abdomen. So at first I have taken the T1 transverse FatSet lower abdomen, select the series, send it to the filming, also send the reference image, and change the layout to 4:6. And delete one image or two images so that the reference image is included. So this is a post contrast lower abdomen T1 transverse FatSet film that I am making and print out. And now T1 sagittal FatSet lower abdomen, select series and send it to the filming, and from the filming layout is 5:5, and adjust the image so that it perfectly fit in the film, and then print out. And the last one is the coronal T1 FatSet coronal lower abdomen. You can see that enlarged posted. Select series and send it to the filming, and layout is 4:6. So there is extra 4 images, delete some from the front and back, so that there is only one film remains, and zoom in the image and adjust the contrast, adjust the window, and then print out. So that's it for MRI of whole abdomen. Hope you like this video. Don't forget to subscribe my YouTube channel and hit the bell icon. Thank you.